Sugar addiction in America, how it happened, how addictive it is, and why it matters to public health. Sugar is not just a taste preference anymore, it has become a major public health problem in the United States over the last 50 to 70 years. Excess sugar intake has quietly reshaped how Americans eat, think, and get sick. And I'm going to give you clear cut explanation, a science based explanation in plain language, how sugar became a national addiction, historical shift. In early 1900s, Americans consumed very little added sugar. But after 1970s, sugar and high fructose syrup flooded the food supply, was added to sodas, juices, breakfast cereals, breads, sauces, and low fat foods. Today, the average Americans consume 2 to 3 times more added sugar than recommended. Sugar comes in many hidden forms. Sugar hides under many names: sucrose, glucose, fructose, corn syrup, high fructose corn syrup, maltodextrin, dextrose, cane juice, agave, honey. I mean, you name it. This makes overconsumption almost unavoidable. It seems like everything has some form of sugar. Is sugar really addictive? Brain science explains it. Research using brain imaging and animal models have shown sugar activates the same dopamine reward pathway, the same pathway involved in nicotine, alcohol, and cocaine. And repeated exposure leads to tolerance, needing more for same pleasure, cravings, withdrawal like symptoms like headache, irritability, fatigue, things like that. So, why is especially addictive? Sugar is unique because it acts fast, like a liquid soda, does not trigger fullness hormone well, and you combine dangerously with fat, salt, and refined starch, which typically found in ultra processed food. This is why people don't binge on broccoli and vegetables, but they can binge on cookies and soda and ice cream. How sugar affects the body? Number one, blood sugar spikes. There's a rapid rise in glucose, large insulin release, burst. Number two, insulin resistance develops. Cells stop responding properly. Body produces more insulin. Fat storage increases. Excess sugar converted to fat. Insulin surge. Insulin is a fat storage hormone. So more spike in insulin, more fat storage, especially visceral fat and liver fat. Chronic inflammation, hormonal disruption, damage to blood vessels, nerves, and organs. Disease is directly linked to excess sugar intake, metabolic disease, which is the major problem in America right now. In fact, all over the world, obesity, type 2 diabetes, metabolic syndrome, insulin resistance, cardiovascular disease, high triglyceride, low HDL, which is good cholesterol, high blood pressure, coronary artery disease, stroke, liver disease, non-alcoholic fatty liver disease. Now leading cause of, just imagine this, now leading cause of liver failure even in children. So you have non-alcoholic fatty liver disease happening in the children, and they're the reason for liver failure in young kids. You could not have imagined this 50 years ago, right? So things are getting bad. Brain and mental health, increased risk of depression, anxiety, and cognitive decline. It worsens ADHD symptoms in children. Dental problem, cavities, gum disease, tooth loss. Now, disease indirectly linked to high sugar intake, PCOS, polycystic ovarian syndrome, gout, chronic kidney disease, certain cancers indirectly related via obesity and insulin and inflammation, sleep disorder, accelerated aging via glycation, and oxidative stress on your cells. So, why this is public health crisis? Well, population level consequences is what? Rising healthcare cost, earlier onset of diabetes and heart disease, shorter health span, years lived without diseases, and increasing childhood obesity and fatty liver. Children are especially vulnerable. Sugar exposure rewires taste preferences early in their life, and it becomes very difficult for these kids to change their habit. And it increases lifetime risk of obesity, diabetes, and addiction like eating patterns. So, you know, I think that is a serious problem. I think solution is just not happening. The lack of political willpower because it's driven by businesses. Sugar is not just empty calories, biologically disruptive. Liquid sugar, soda, energy drink, juices are almost most harmful. And there's a one product which comes in a canned juice, orange juice, and I think which has been taken off shelves. I think from Minute Maid, frozen one particularly, um, because of that reason. Addiction like behavior is real and well documented. Many chronic disease share the same issue, which is sugar-driven insulin resistance as the root cause. Reducing added sugar will improve energy, weight, blood sugar, heart health, brain health, your health in general. So, sugar did not harm Americans overnight, but chronic hidden exposure over decades has fueled an epidemic of preventable disease. The solution is not extreme diet. I think that as people become more aware, educated, a gradual reduction is starting with eliminating sugary drinks, avoiding ultra processed food, and rewiring, retraining your brain to enjoy real food again. So that's why my health education video is all about making people aware about healthcare issues. So if you understand why certain things are happening, a lot of people are gonna make positive changes, and you'll see the difference. Make those changes for a few weeks and see the difference for yourself. So thank you for watching TGIF, and I'll see you next video.